we are very excited about the future for patients with brain metastases, first of all. And some of the research where we are working on, and several other groups in the country and across the globe are working on, is now how to define these interplay of focused forms of radiation, say stereotactic radiosurgery, and targeted therapy. So to give an example, I serve as a principal investigator of a study that is using both stereotactic radiosurgery along with osimertinib in patients who have EGFR mutated tumors. So patients will undergo the radiosurgery in a single session, and then they will get drugs after that, as long as they're getting benefit in the brain. Some of the research that we and others have been involved with have found that if you do combine these two avenues of drug and focused forms of radiation, you may even have better outcomes in your patients as compared to using either one modality or the other modality. And the other area of research which is very fascinating is combining these same focused forms of radiation like stereotactic radiosurgery along with immunotherapy. Because one of the advantages when you use focused forms of radiation is you can actually cause new antigen expression. So essentially you're using radiation now as a vaccine to mount more of an immune response. And then if you give an immunotherapy, you may have a much stronger immune response than you would have with just immunotherapy alone. And we recently published a fairly large experience of over 150 patients who were treated with the either immunotherapy or radiosurgery or a combination. And what we found out was if we gave the two very close to each other, one half-life of the immunotherapy, we had the best responses in terms of maximum shrinkage of lesions. Now we are in the process of testing this prospectively in a clinical trial in patients with lung cancer, brain metastases with immunotherapy and stereotactic radiosurgery. So very excited about the next 5 to 10 years with patients. And I think a lot of research will focus on how to combine the radiation, mostly focused forms, along with some of these targeted agents or immunotherapy, scheduling, how do you schedule them or sequence them one after the other or together, how often would you deliver the radiation, and what's the best avenue to do that. So these are some of the unanswered questions that we hope to find answers to as we provide best outcomes for our patients with brain metastases and lung cancer.